Hello everyone, welcome back to my YouTube channel Speedy Dentistry. Today we'll be learning about cavernous sinus thrombosis. So basically in this disease there will be thrombosis inside the cavernous sinus. So first we'll learn about the anatomy. This one is the pituitary gland. These are sphenoidal sinuses and this is cavernous sinus. To mark the inside structures, this is internal carotid artery. Since it is inside, so it won't be external, it will be internal carotid artery. Nerves will be 3, 4, 5, 1, that is V1, and 5, 2, and 6th cranial nerve. This will be the anatomy for cavernous sinus. Next, how does the cavernous sinus thrombosis occur? So etiologically, it can be due to septic or aseptic foci. Septic foci could be sinusitis, otitis, any odontogenic infection, or from facial structures. It could be furuncle or erysipelas. For the aseptic causes, it can be a surgery or trauma. So basically what happens for the septic cause, when bacteria is present, it leads to increased thrombosis and procoagulation substances are released. Also the toxins from the bacteria causes the tissue damage. Coming to the pathway for cavernous sinus thrombosis, anteriorly the infection can go upwards or retrograde direction and also posteriorly. So anteriorly it starts from facial vein, goes upward to the angular vein, then superior ophthalmic vein, and finally to cavernous sinus. Now the posterior, from pterygoid venous plexus, it moves to emissary veins and to cavernous sinus. Next, we should know how would the patient present with cavernous sinus thrombosis. So the clinical features is, first one is eye signs. The signs of sepsis will be there and CNS signs will be there. Eye signs, we'll see chemosis. Chemosis will be present. There will be peri-orbital edema, that is edema around the orbit. Also proptosis and painful globe, that is the eye globe movement will be painful. Also headache due to the eye signs will be seen. Coming to the signs of sepsis, for the signs of sepsis, picket fence pattern of fever will be noticed. Also the heart rate will be increased, that is tachycardia, and hypotension will be there. Also fever will be associated with chills. For the CNS symptoms, there will be meningitis, in which Kernick sign and Brudzinski sign will be positive. These signs will be positive. Also coma or death can be associated with cavernous sinus thrombosis. Coming to the criteria for cavernous sinus thrombosis, it is known as Eagleton criteria. Remember it via eagle, having 3 S3 phones, that is Samsung 3 S3 and a pen. So there will be S3 and pen. So this is the mnemonic for Eagleton criteria of cavernous sinus thrombosis. First S is for site of infection will be known. You will be knowing the site of infection. Second S is for septicemia, and third one is for signs of venous congestion can be seen. Coming to the next mnemonic, pen, P stands for paralysis of 3rd, 4th and 6th cranial nerve. E stands for evidence. So there will be evidence of meningeal irritation. And N stands for neighboring. So neighboring soft tissue abscess will be noticed. Now coming, when you have suspected that cavernous sinus thrombosis in a patient, so we go ahead for the management. First is we give the high dose empirical antibiotic, and then we confirm the diagnosis using CT or MRI, and we go ahead with culture sensitivity test. So if the foci is septic, so in septic foci we give antibiotic therapy, incision and drainage, IV unfractionated heparin. In the video of heparin, we have remember that it is similar to a hairpin that the pregnant lady is wearing, and it is a anticoagulant. So in this disorder, we know in cavernous sinus thrombosis, thrombus is there, so we need an anticoagulant. So we give IV unfractionated heparin. Also, we provide corticosteroid support and mannitol for osmosis. So mannitol is basically antidiuretic, so it will decrease the pressure. If the foci is aseptic, antibiotic therapy is not required, and also incision and drainage is of no use. We provide IV unfractionated heparin, corticosteroid, and mannitol support. Also, thrombolysis are prescribed. For the antibiotic, chloramphenicol, 1 gram 6 hourly is prescribed in a IV dosage. Thank you and stay tuned for more.